The climate theme
we
here.
Sure are.
We all should be caring
Yes.
about it because this week is Earth Week, and according to a report published by California's Environmental Protection Agency, California's climate crisis is rapidly getting worse.
Yeah, now it's taking a toll on people's health, well-being of all of us here. So we have Dr. Abisola Olulade, Chief Impact Officer at Sharp Reese Steely. Dr. Abby, it's so good to see you.
Hi, Dr. Abby.
Yeah.
Nice to see you. Thanks for coming in.
Yeah, we're glad to be able to talk to you about this because we know climate change affects people around the planet, some in many different ways, some more extreme than others. But let's talk about this. How does our health get impacted by what we're seeing happen on a global scale?
So the big thing to know about climate change is that it's called a threat amplifier. So every insecurity that we have, whether it's food insecurities, health insecurities, socioeconomic insecurities, are going to be made worse by climate change. And we see all of that. So we've seen higher temperatures. 8 out of the last 10 warmest years on record were in the last 10 years. So we know that that's rapidly getting worse. And we're seeing, of course, because of the heat, more drought and more wildfires, which causes issues, and also a lot of flooding, which leads to what we call vector-borne illnesses, so an increase in infections like valley fever. So all of this does have an effect.
Can we talk a little bit about the allergy component to all of this? Because I'm an allergy sufferer. I'm on my pills here. This is the time of year where things are starting to ramp up. But the impact that climate change has had on our seasonal allergies, are they getting worse because of the climate change we've been seeing?
Absolutely. So we're having longer and worse allergy seasons because we have higher temperatures, which lead to higher levels of pollen, and that also is associated with the increased CO2 in the atmosphere. So every single doctor will tell you that we're seeing a lot more sniffling and sneezing and itching, and that, of course, causes a lot of issues.
Okay, yeah, that's interesting to note with CO2 as well, because you hear carbon dioxide affecting our ozone, and it brings these big swings in weather, the extremes that we've seen with the flooding and then the wildfires, but also our health. CO2 can impact, because it's what we're breathing in, right? Could you explain what that means and how that does hurt us?
Absolutely. So we're seeing, because of it, it's really the effects, so the secondary effects of it, because we're seeing a lot of heat, so we're seeing more people that have occupational exposures to these higher temperatures, more ER visits because of it. And then when you talk about those wildfires, what we see is actually higher levels of CO2, and also they have things like carcinogens in the wildfires, and they also increase the levels of what we call the particulate matter, which is that very fine particle that can get deep into the lungs and go in the bloodstream. And every single county in California had, in 2020, which was one of the worst wildfire seasons, 46 days of people being exposed to this particulate matter.
Wow, okay.
And it travels really far and causes worse lung issues, and it causes a lot of issues. So we really need to think about it.
Also
I'll never forget that smoke traveling from California all the way to New York.
Oh, right.
Remember the wind just took it across the country. So obviously we deal with it here when there's fires in people's neighborhoods, but then it spreads. It's not just us.
Yeah, absolutely. These funguses that we're seeing, deadly funguses, these mold spores, also impacted by climate change here?
Absolutely. So because we have a lot of dust, these fungi live in the soil and get carried out, and they travel very far. So valley fever is a kind of fungus that causes lung issues. It cost the state in the last, in about a period of 10 years, it cost the state close to $2 billion. So even the cost of that is so important, and it can cause really, really bad issues. We're also seeing this Candida auris, which may be linked to climate change as well. So everyone is affected by climate change in some way, and all of us affect climate change because we all have a carbon footprint. So it's important to think about this.
Yeah, to clarify for our viewers at home, you know, when you talk about CO2, that's obviously from the stuff we spew, the pollution from cars, from certain industries, airplanes, things like that, and that's stuff we all are breathing in. You know, so it's something to keep in mind.
Something we can do something about, though, too, right? To lower those amounts.
Yeah,
absolutely. So all the things that you will do to help climate change and planetary health are actually things that will contribute to our well-being. So walking more when you can, eating less meat, because we know that certain animals produce more methane that can also affect affect climate change, so eating more plants. All of these things are important. So when we think about planetary health, we're actually thinking about and improving our own health, and that's the important thing to remember.
It's interesting because we talk a lot about our carbon footprint, right? And our feel good. Like this makes us feel good when we're cutting down but we're talking about our health here that we can have a big impact on as well if we all do those little things that you highlight.
We try to highlight, but I mean, to think about it like your kids' health, your health, your parents' health. I mean, this is, and a lot of times, unfortunately, poorer communities are impacted worse. We know pollution, for example, might be worse along our borders, and those communities have bigger asthma rates, higher lung disease issues, things like that, right?
Absolutely. And in poorer communities, we know that they have less of an ability to prevent climate change. They cannot relocate, for example, and they can't recover from the devastating effects. And actually, when you talk about things like pregnancy, for example, when there is more wildfire smoke, we do see higher rates of complications such as preterm births. We also know that children are more affected by this because their lungs are still developing. So all of this is something we need to think about, and it's urgent. And that's what this report is telling us, is that we really do need to act now.
We can all do something to help our own health here.
Yes,
that's
of
right.
course.
Dr. Abby, thanks for coming on. Really appreciate it. Nice to see you.
Good to get your insight. Yeah, to get that medical advice from you is always, we're very fortunate to have that, especially Earth Week.
Yes.
It's starting today, so important discussion to have.
Absolutely.
It's so good to see you.
Thank